Is hormonal sensitivity part of joint hypermobility syndrome or EDS? This is such a big and integral part of managing and dealing with hypermobility, because in women there's a hormone called relaxin that is released after ovulation. And so when that hormone is released, it interacts with the estrogen and progesterone and in effect makes your tendons and joints more lax. So when you're already hypermobile and your joints become looser, that does not help you. If anything, that tends to make your symptoms worse, and it makes everything harder to move, harder to exercise, and a lot of times we'll see your pain spike up as well. The hormones are a normal part of the system. They're important, they're biologic, they have good functions. This is just kind of an unfortunate side effect that tends to get magnified with hypermobility. And if you're having significant swings where you do pretty good and after ovulation your symptoms start and increase through your cycle, and then you kind of get better, you have a week where you're doing pretty good and then things spiral out of control again, that's when I have my patients talk to their doctor and find out if there's something that they can do to better control that, because it gets really hard to make progress when you only get 1 week of a month where you can actually work on things, and the rest of the time you're just trying to hold yourself together. If that is you, you do want to think about tracking your symptoms so that way you can kind of correlate them to your cycle, so writing them down on a calendar. And then it can also depend on other factors as well. So for example, you might have 1 year where you really notice it, and then a few months later it doesn't seem like it affects you as much. And that happens fairly regularly too, depending on what your overall strength is. You know, if you've been sick and you're weaker, you're gonna feel it a lot more. If you've had more stress going on in your life, you're gonna feel it more. If you're more taxed, you haven't been able to get as much sleep, all of those things are gonna combine to where 1 month you might really notice it like to the day, and a few months later it's just kind of a blip. So no, you can have variability because of all the other things too. And one of the best things you can do with that is create a game plan, because once you know it's affecting you, if you're tracking your cycle, you can pretty much start to predict when that's going to occur, and then you just get smarter. So one of the things that I use in the clinic a lot is called an SI belt, because if our body's going to have less stability, we want to give it more stability. We want to use orthotics, braces, good posture, all those things that can be helpful. And so SI belts are part of that process. An SI belt goes around your pelvis, not your belly, your pelvis. So it goes kind of just below the hip bones in the front and the hip bones in the back, and you are just going to cinch it up. This particular brand, and there's lots of brands, is a Sorolla. It's definitely my favorite one because it's low profile, so you can wear it under your clothes. But what you do is you put it on tight and you tighten it up around your pelvis, and it holds your pelvis together. So that way it creates a little more stability for you. Stability in your trunk gives you more mobility and more strength in your limbs. So having stability here is more effective than trying to brace your knees. You want to keep yourself strong through your trunk. But orthotics, if you do have knee issues, that's when you want to brace. And you also want to kind of clean up your movements and your postures to make sure that you're supporting yourself. So where you might normally be able to get away with kind of doing a little more slumping and not having to be so straight, during this time you might have to be a little more careful because you're going to notice it more. So that's the SI belt. That's kind of what it looks like. Great things when you need them, and you can kind of use them off and on as you need to, particularly for things where you're more active. So if you're just sitting around, not as important, but definitely walking, moving, if you're having issues with that.